Black healthcare practitioners were being discriminated against between 2012 and 2019 by medical aid schemes. That's according to a Section 59 report that was handed over to Health Minister Aaron Motsoaledi at the Council for Medical Schemes office in Centurion. The council was instructed by Motsoaledi to run the investigation more than 5 years ago. The investigations zoned in on two main areas: procedural fairness and substantive unfairness, outlining systematic patterns of discrimination. The industry failed on both fronts.
For GEMS, black dental therapists in 2014 experienced risk ratios of between 2.7 and 3.7. In other words, they were generally approximately 3 times 300% more likely than non-black dental therapists to be guilty of FWA, fraud, waste, and abuse. For discovery, black psychiatrists in 2017 experienced risk ratios of between 3.44 and 3.77. In other words, black psychiatrists were generally approximately 3.5 times, 350% more likely than non-black psychiatrists to be guilty of fraud, waste, and abuse. For med scheme, black anesthetists in 2018 experienced risk ratios of between 6.39 and 6.78. In other words, black anesthetics were generally approximately 6.5 times, 650% more likely than non-black anesthetics to be guilty of fraud, waste, and abuse.
While there are more than 71 medical aid schemes, Section 59 focused on the three: Discovery, MedScheme, and GEMS, as they received most of the complaints and are the largest schemes in the country. Several recommendations have been made, including for the schemes to review the clawback period, particularly around historic issues, an update of regulations, and keeping up with the technology used by medical aid schemes. The minister accepted the report and recommendations and highlighted that the country should be ashamed that discrimination of professionals based on race is still happening 30 years after democracy.
Advocate, I accept the criticism, perhaps of the Act and the weaknesses in the Act. But you will realize, ladies and gentlemen, that the manner in which the private sector came into the country was never planned and designed. It just evolved.
Chair of the Council for Medical Schemes, Dr. Thandi Mabeba, says her office is committed to making quality healthcare affordable for all South Africans.
Indeed, the Council for Medical Scheme supports the national policy, which is the National Health Insurance. The Council for Medical Scheme is a regulator to the schemes, and it is actively engaged in ensuring that the benefit packages that are afforded to the members of the scheme are affordable.
With the recommendations now on the minister's table, he will take some time to read through the documents before giving an official response and deciding on the way forward. He was clear on one thing, though: the country cannot afford to have two healthcare systems. Otherwise, these kind of issues will continue. For Newzroom Afrika on Channel 405, I'm Ntokozo Khumalo in Pretoria.